Okay, here we go again. So this is part two, really getting into this idea of posture. We'll be working on this in the lab. We're going to be assessing each other's posture in the lab, see what's going on for different issues with us. Posture is a really key thing to look at with somebody. It's usually the first thing I look at when they walk into the clinic or I'm going into their home or hospital room. I want to check out their posture. I don't care how old they are. Posture, I can work on that. It will fix and help them with a lot of different kind of things. Posture is kind of driven and influenced by injuries, trauma, emotional conditions. I think I've seen a lot of people who are dealing with mental health issues or just low energy, and they're coming in kind of all slouchy. Your thought patterns, that sort of stuff. It really reflects kind of a lot of who you are physically, I think, and mentally. mentally. But in this class, we're really thinking about job demands, like the sitting all day are really driving people's posture, and kinesthetic awareness. Do you have good kinesthetic awareness or poor kinesthetic awareness? I can look at somebody and think, oh, I've got good posture, or I don't even think about it, and go, yeah, it's obvious because you're not even aware of what's going on, with your body posture-wise. The good news about posture is most of it is reversible. Even for a lot of older folks, you can make a big difference. Like this LSVT stuff, a lot of these clients who have Parkinson's disease, an awful disease, it just does all these terrible things to your body, especially your posture and stiffness. There's exercises we can do, these LSVT exercises, we'll get into some of them, that can help with posture, even with this population. A good kind of rule of thumb, I don't know if I said this before, to see if you can work on somebody's posture or not. So you're working in a nursing home or hospital and you have this, old lady, older man, and they're all, kyphotic and hunched over, and you wonder, geez, do I tackle their posture, or did I think it's like horses left the barn? A quick way to kind of assess is passively see if you can range them, pull them gently back into neutral. So kind of pull their shoulders back, their neck back, if they can't seem to do it. And if you can pull them back, even into a small degree, you can work on it. And think of all the lung capacity you can increase with a lot of these older clients, and just get more shoulder range of motion. If you can just get them back a little more, feeding, swallowing, all these amazing things you can do by improving their posture. Okay, moving on here. So posture, ergonomics, the job drives the posture in a lot of cases. Results in increased risk for work-related injury. Look at this poor dude. He's hunched over this thing all day, working on his experiments around new treatments for COVID-19 or something. I don't know what he's doing, but he looks awful. Fatigue. We talked about fatigue. This lady is a little bit fatigued. I'm not sure what's going on, but she looks definitely tired as she's just slaving away there. Fatigue leads to poor posture, leads to neck pain and all kinds of awful things. Poor posture equals DMPs, dysfunctional movement patterns. What does that lead to? Pain, over and underuse. Okay, so let's talk about posture. Muscle overuse. Certain muscles are just getting wailed on, really getting beaten up, sore, full of trigger points, tightness, all these awful things because of the person's posture. Forward head. These two pictures, this dude, he's got the wicked forward head. It's wailing on his scalenes and levator scap in particular, really making them muscles from hell, making him very sore, giving him neck pains, headaches, awful things. Rounded shoulders. This guy's got the wicked. See this C? There's like a pelvic tilt going on here. Rounded shoulders really causes tightness in the front, anteriorly, in the pec minor, subscapularis. Subscapularis can be very, very sore. A lot of people with poor posture. Pec minor, we know that's a key muscle. Remember? Do you remember? Hopefully you remember. Brachial plexus goes right under that pec minor. Tight spot, tight corner around through there. Causes potentially all kinds of pain. Hitting that nerve coming down into the hand, the chest, all because of rounded shoulders. excessive posterior tilt, kind of here. A great example of it, but excessive posterior tilt. This is one of your questions. This is the ones that people always mess up on the quiz and the exam. When students mess up on some of these questions, certain professors want to keep giving the questions until people get them right. I don't know who that is, but some professors do that. Anyway, so the excessive posterior tilt can lead to issues with the lumbar discs, and it really wails on the spinal extensors, these guys down here. Low back pain. A lot of men have low back pain. Why is that? Classic flat back. Too tight. Too tight up here too. It's just bad news. Need more of a tilt. Not this excessive tilt, but a little tilt. Okay, here we go. Pelvic tilt again. The old pelvis. Gotta get this down. This is one of the things that just throws some students off, and they just get it all screwed up in the midterm, and you get that screwed up in the midterm, and it's just going to cost you lots of points. You want to get this down pat, down cold. Here's our handy-dandy pelvis. Again, think of the bucket, think of the square, kind of like right like that. Which way is it tilted? Forward? Is the bucket tilted forward, leaking water? Or is it tilted backwards? Forward or backwards? It's tilted this way. The butt comes out a little bit, getting that curve right there. Anterior tilt. The psoas pulls and gives you more anterior tilt, which we wanted for Vladimir Putin. We want him to do exploration 1 through 4, hint, 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 to get that tilt in there. Neutral optimum pelvis is just a slight tilt. Causes DMPs if it's too far one way or the other. Okay, here's some more examples of the anterior tilt, pelvic tilt, posterior tilt, and there's some other problems that go with the pelvis that we're not going to get into. It gets too complicated. Effective pelvic tilt, hip and knee hyperextension. Oh, that's a good example. On lower body posture. As that tilt comes back, if you stand and do this, just stand and rock your pelvis back and forth. It's a pretty amazing thing to do. Back and forth. If you go back posteriorly, you're like, oh my goodness, I'm locking my legs. I'm feeling stress on my knees. The knee pain could be caused by posterior tilt, pelvic tilt, especially if you're standing all day. You're standing all day at this job, or you're a flagman on the road. You're standing all there on this hard tar road, 8 hours, 10 hours in a row, and you get the flat back, the posterior tilt, and you can finish the shift and you go, oh my God, my knees are killing me, especially the back of my knees. It's because of your tilt, because of your pelvis. Okay, roll the abdominal muscles in posture. Overactive rectus abdominal muscles equals flat back. This is the rectus abdominis, these beauty muscles in here, the six-pack. These are the muscles that Batman and all those superheroes they look incredible. They look amazing, and they get all these girls because they just have this amazing six-pack, which they work on 24 hours a day. But it's not necessarily a good thing, because it's pushing your pelvis posteriorly this way, where the arrows are going, actually, these arrows, which is not necessarily a good thing, causing flat back, disc damage, crunching those spinal extensors. So, moral of the story is, overdeveloped rectus abdominis, a lot of men have that. They're super obsessed with lifting weights and stuff, doing those crunches, those sit-ups, can lead to low back pain, disc damage, all that. Need to relax these guys a little bit. Engage the hip flexors. Bring that pelvis forward anteriorly. Collapse back. He definitely does not have a collapse back here. He's straight as an arrow. Great, amazing trunk extension. But let's say he was all slouchy in the chair. Just slouch in your chair. What I mean by collapsed trunk is it's shortened. Everything's kind of crunched up. Your little ladies were living in that wheelchair for 20 years. In the nursing home, you'll see them and they're all like, oh, the trunk is all shortened up. They need to extend their trunk, elongate it, open up their lungs. How do we do that? Which muscles do that? These transverse and oblique abs. These guys on the side. Not so much the ones in the middle, but the ones on the side. Those are the ones we really want to get going, really extend that trunk without giving us all that posterior tilt stuff. And it's this really cool exercise. You probably just can't wait to try this one. It's part 3, week 3. It's called the Spider-Man, and you're kind of like Spider-Man walking up a wall. I'll show you how to do this one. And it's great for increasing kinesthetic awareness of these guys. I do that exercise and boom, I'm like 2 inches taller, 20 years younger. I feel like I'm growing hair. No, it's just a good exercise for trunk extension. All right, so excessive anterior, posterior tilt. This is a really cool breakdown of how to, which muscles are getting overused and how to fix the problem. It's almost like a cookbook. They have posterior tilt, excessive posterior tilt. This is what works to help relieve it. They have excessive anterior tilt. This would help kind of correct it. Again, you're seeing a lot of this with back pain, but at least all these other issues as well. Let's look at the flat back, posterior tilt. A lot of standing jobs, common with men. A lot of men at the flat back. You know, they're kind of waddling around when they get older, all tight. Their pants are coming down because they're just so flat. It's not a pretty sight. So what's overused? The rectus abdominis, too tight in here. Hip extensors, too much hip extension. Underused. Hip flexors, this is the opposite. These are the hip flexors engaging. It'll bring it forward, a little tilt. Iliacus and psoas. Exploration 1 through 4 is great for posterior tilt. The opposite, excessive anterior tilt. This is a lot of women, females, I'm kind of generalizing, but they have, generally speaking, have a lot more anterior tilt. It can be excessive. And when it's excessive, you're getting crunching down here with the discs and the extensors. Not a good job. Again, standing could lead to this if you're standing all day. With excessive anterior tilt, just think the other way. Get those rectus abs going, the hip extensors going. A great exercise for that is just, some of you have done this one before. It's a great crunch one. You've got to pull your belly in, if people want to pull their belly in. You lay flat on your back, supine, on a mat or on the floor. The floor is even better. You do leg lifts, and as you're doing the leg lift, you tuck your stomach in. You're pushing into the mat, pushing into the floor, right in here, kind of like this picture. As you're lifting your legs up, that'll really get that tilt going back the other way. Then we talked about the collapsed posture. You need to engage the transverse and obliques and do the Spider-Man. This is an amazing, amazing chart. Breaks down posture. It shows you what's overused for muscles, what's underused for muscles, what jobs cause these problems, and how you can fix it. Here's the forward head we've already talked about. Jobs where you're looking down, excessive sitting, laptops, texting, looking over a table all day, doing fine work, leads to this, leads to neck pain. How do you fight that? The chin tuck, the wall lineup, I can show you that one, the pelvic tilt, scapular retraction, I'll bring the neck back. Millions of exercises that we talked about. She's got the classic rounded shoulders. She's not using her rhomboids. They're like just hanging out here, doing nothing, slacking off on the job. You need to get those guys going. You need to wake them up, make them more aware that they're muscles. Muscles need to have some tone and contraction to them. Boom, this is what happens. Get those rhomboids going, along with the mid-traps. Shoulders, are they internally or externally rotated here in the before picture? They are internally, sorry, I keep flicking that, it's probably irritating. In this picture right here, they are internally rotated. The protracted scapula is lead to internal rotation of the shoulders. So we need to do the opposite. We need to externally rotate the shoulders. So we need to engage which muscles externally rotate? Yes, you're right. Teres minor, infraspinatus. These guys right here, they'll spin that humerus out, externally rotate. Here's the posterior anterior tilt we just talked about. All right, that's the end of that amazing